Hi, I'm Fran Wild, one of the dietitians that works here at BMI, and today we're going to go through the bariatric surgical open house presentation. Thank you for taking the time today to watch this. We hope by the end of the presentation you'll get to know a little bit more about the Bariatric Medical Institute and the team that work here, to understand obesity as a chronic medical condition and how bariatric surgery is one of the treatment options, to gain an overview of the surgical procedures performed at the Civic Hospital, in addition to understanding the benefits of surgery and some of the risks involved. We will also discuss the surgical pathway and what is involved for you to safely move through the different stages to go on to have surgery. We will briefly look at some of the foundations of healthy living post-surgically. However, this is a topic that will be discussed in much more depth when you meet the BMI team. If you're not familiar with the Bariatric Medical Institute, we opened in 2004 and consist of a multidisciplinary team of health professionals, which include physicians, a psychologist and paediatric social worker, a team of registered dietitians and fitness coaches. This next slide is an important one, and that's because, unfortunately, there's still a lot of misconceptions about obesity and the factors that influence our own personal body weight. Obesity is classed as a chronic medical condition, and it's time to stop shaming and blaming people for their weight and start treating obesity as the chronic and relapsing disease that it is. There are numerous factors that influence our own personal body weight, from genetics to medications, our environment to the hormones that regulate our appetite. What we eat is only one part of the equation. We know that obesity is associated with many health conditions. These include high blood pressure, sleep apnea, heart disease, some cancers, depression, chronic pain, and type 2 diabetes. The good news is that even a 5% weight loss can result in improvements to our health and quality of life. Research has found that cholesterol, blood pressure, type 2 diabetes, inflammation, and sleep apnea all improve from this amount of weight loss. So what is bariatric surgery? Well, it's one of the treatment options used for obesity. It's an aggressive medical and surgical treatment for long-term weight management. It's overseen by surgeons and physicians, dietitians, fitness specialists, and psychologists. The BMI surgical programme is delivered in partnership with the Ottawa Hospital's Weight Management Clinic. The Ottawa Hospital provide the immediate pre- and post-surgical care and is where the surgical procedure is performed. The BMI team will work with you prior to surgery to ensure you're a safe candidate ready to move forward through the pathway. We will also support you after the surgery, helping you to adapt to the post-surgical lifestyle, supporting you with any nutrition challenges you may face, and think about different strategies you can implement or experiment with to ensure your future success. This next slide is a diagram of your digestive system and highlights how food is digested and nutrients and fluids are absorbed all the way from the mouth to the large intestine. By having bariatric surgery, your digestive system will be altered. Let's take a look at the different procedures offered at the Civic Hospital and how they change your digestive tract and can be used as a treatment option for obesity. There are two different procedures that clients from the BMI surgical pathway will go on to have, either the Roux-en-Y gastric bypass or the vertical sleeve gastrectomy. First, we are going to take a look at the Roux-en-Y gastric bypass procedure. This diagram shows how the stomach is used to create a small gastric pouch. The jejunum is then brought up to the gastric pouch and a large portion of the stomach and the duodenum are bypassed. This bypassed duodenum is then reattached further down the jejunum as it is still used to produce digestive juices. This short video demonstrates how the Roux-en-Y gastric bypass is performed.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
The benefits of the Roux-en-Y gastric bypass are as follows. A smaller pouch is created which limits the amount of food an individual can eat at any one time, making it a restrictive procedure. The pouch is approximately the size of one egg or half a cup. As the duodenum is bypassed, this results in malabsorption of nutrients. Hormones that regulate your appetite are altered by the procedure, which can reduce hunger and increase satiety cues. Improvements are seen in weight-related diseases such as cardiovascular disease, hypertension, type 2 diabetes, and sleep apnea. The average weight loss seen from this procedure is 20 to 35% of total body weight in approximately 12 to 18 months. The vertical sleeve gastrectomy is the other procedure that may be used for the BMI surgical clients. This is a less common procedure in which approximately 75% of the stomach is removed, making a smaller, restrictive sleeve. This results in clients feeling fuller sooner and with a smaller portion size. The average weight loss is anywhere between 15 and 25% of total body weight. An individual might go on to have a gastric sleeve for several reasons. It may be that they have pre-existing scar tissue which would inhibit the surgeons from completing a Roux-en-Y bypass, or they may rely on the use of non-steroidal anti-inflammatory drugs such as Aleve, Celebrex, Advil or ibuprofen. Bowel disease such as Crohn's or colitis would be another factor that would prevent the Roux-en-Y bypass being performed. Here is a short video that demonstrates the sleeve gastrectomy procedure.
The sleeve gastrectomy is a restrictive procedure, which limits the amount of food you can eat by reducing the size of your stomach. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
As with any surgery, there are some associated risks. Acutely, there is a small risk of stricture or obstruction or a gastric leak. Because of the restrictive and/or malabsorptive nature of the procedures, clients are at a higher risk of malnutrition or nutritional deficiencies. Food intolerances can develop post-surgically. People can also experience indigestion, nausea, vomiting, constipation or diarrhea. There's also a risk of hernia, in addition to a higher risk of addiction behaviour transfer and feelings of depression or suicide. This slide demonstrates the percentage risk of the following complications. It's important to note that because of the restrictive and malabsorptive nature of the procedures, clients will require vitamins for life and are at a higher risk of nutritional deficiencies. Dumping syndrome occurs in between 50 and 75% of clients who've had the Roux-en-Y gastric bypass. You will work with members of the BMI team to identify triggers in order to minimise the frequency that this may occur. Weight loss can increase fertility. However, it's important that women wait at least 12 to 24 months before getting pregnant. Prior to this time, the body is changing quickly and you're at a higher risk of nutritional deficiencies, complications or miscarriage. It's also important to take time to adapt to your new post-surgical lifestyle. Some weight regain is expected. An average of 15 to 25% regain between 2 and 5 years post-surgically is common. At 15% or more, it's likely that weight-related diseases may return. You will work with the BMI team to implement strategies both before and after surgery to support your weight loss maintenance. Mortality rates are low and between 0.2 to 2% for individuals having the Roux-en-Y procedure. There have been over 1,800 surgeries performed at the Ottawa Hospital and 3 deaths, the last one in 2011. The most common cause of mortality include a blood clot to the lung or infections due to a gastric leak. These are the criteria that must be met for you to qualify for surgery. You must be between the ages of 18 and 65, have a BMI of 35 or more with weight-related conditions, or a BMI of 40 plus. You must be a non-smoker and have been nicotine-free for at least 6 months. You must not be using anti-inflammatory drugs, or you will be put through to the sleeve gastrectomy surgical procedure. You must be able to demonstrate an ability to lead a healthy lifestyle, have a stable mood or psychiatric status, have no active eating disorder, have treated sleep apnea and have been using a CPAP machine for at least 30 days to show compliance, and have well-controlled blood glucose management with an HbA1c of 8.5% or less. It's important to stress that surgery is only a tool, not a cure. In order to reach your health goals and maintain them, the following 3 steps are vital: exercise, nutrition, and sleep. We're going to look at these in more detail now. Nutrition. It's essential to find a way of eating that's sustainable, safe, helps you meet your health goals, and that you enjoy. At BMI, we use a pre-surgical nutrition checklist to remind you of the key strategies that will help you lifelong. These include tracking or keeping a food diary. Apps such as MyFitnessPal or Baritastic can help you gain a more detailed view of your nutritional intake. We use this data to ensure your protein requirements are met, to learn about the rhythms of your appetite, and it's one of the most effective tools for weight loss maintenance in the future. It's important to stress that tracking should not be used as a judgment tool, but seen as data that can help you throughout the pathway. Balanced meals based off the Canada Food Guide are important to ensure your body gets the nutrition it needs. Mindful eating is important, and we will work on strategies to eliminate emotional or boredom eating. As your pouch will be much smaller, it's important to eat every 3 to 4 hours. Hydration is also essential, along with the elimination of caffeine, alcohol, sugar-sweetened drinks, and carbonated drinks. This is a brief summary of the diet progression after surgery. Similar to a weaning process, you will be moved throughout the different stages and textures to find your new diet for life. Fitness. In order to prevent muscle mass loss, you'll be supported by a fitness team to help you incorporate exercise into your day-to-day life. The benefits of fitness and activity go far beyond maintaining muscle mass. Activity is beneficial for both your physical and mental health. Sleep. There's a higher risk of sleep apnea for individuals with obesity. You may be screened and tested for sleep apnea. If diagnosed, you'll be required to use a CPAP machine daily and take this with you to your surgery. This may sound like a lot of steps and things to take into consideration. However, it's important to remember to take one step at a time. Using SMART goals, we hope the behaviour changes you make are sustainable and you're able to experiment with and identify your own personal strategies that will serve you for the rest of your life. Congratulations! You have just taken your first step into the pre-surgical pathway. Let's take a look at what comes next. If you wish to proceed, you will need to book with our front desk for an initial appointment with Dr. Friedhoff. This will be followed by 4 to 6 dietitian appointments and potentially a review with a psychologist. If you are able to implement the habits outlined in the pre-surgical checklist, you will move forward to the pre-surgery class to learn more about some of the steps during the recovery period and the diet for life. Your file will then go to the hospital, where you will meet the surgical team. Once you have a surgery date, you will be told to start the Optifast liver shrinkage diet approximately 3 weeks before your surgery. If you are interested in learning more about the bariatric surgical pathway, book in with the front desk team and they will arrange for your intake appointment with Dr. Friedhoff. In this appointment, your blood work will be reviewed to establish a baseline. You will have opportunity to discuss your health goals in addition to your social and medical history that may have led you to exploring the bariatric surgery pathway as an option for you. Dr. Friedhoff will review your medical history and discuss some of the considerations for surgery with you to ensure you're a safe candidate to move forward. All care at BMI is patient-centred, and you will begin to work on a treatment strategy which is tailored to your own needs. From this, you will work on an action plan for future appointments. Timelines will vary dependent on your personal treatment plan. On average, the pre-surgical component of the pathway takes between 4 and 8 months, but it could take longer if any further tests or investigations are required. During this period, you will learn the skills and habits you will require post-surgically and the dietary changes that will help you towards your future success. Post-surgically, you'll be followed up for approximately 2 years. This period will be used to help you during your recovery period and to adapt to a new way of eating. We will also work together to find strategies that may be beneficial for you in case you encounter any roadblocks along the way. There are some considerations you need to factor for if you plan to proceed on this pathway. Optifast is a nutritional shake that's taken 4 times a day for approximately 3 weeks with no other food. This is to reduce the size of your liver by approximately 25%, so the surgeon is able to safely conduct the surgery. There is a one-time cost for Optifast of around $200. Vitamins are essential to take every day for the rest of your life. There are several different types of vitamin regimes for you to choose from, but on average this will cost you approximately $60 each month. You will need to factor time for appointments, pre and post-surgically, and you will need to take 4 weeks off from work immediately after the surgery. You may need transportation to get to some of your appointments. However, it is possible to do the vast majority of the appointments with the BMI team virtually. In order to stay on the pathway, there must be no longer than 2 months between each appointment, so always make sure to call ahead and book your next appointment. There are non-surgical weight management options also available. At the Bariatric Medical Institute, we offer a 22-week adult programme that includes input from Dr. Friedhoff, dietitians and fitness coaches. This costs $1,850 plus HST. At the Ottawa Hospital, they offer 2 programmes. The Lifestyle programme, which costs just the food journal and cookbooks with an average weight loss of 7 to 10% over 2 years, or the Optifast programme, which costs between $800 to $1,400, which is the cost for the shakes that you'll be taking for the duration of this programme. If you are interested in pursuing any of these options, then please feel free to contact either the BMI front desk or the Ottawa Civic Hospital. At BMI, we have a 3 no-show policy. So if you do not attend 3 appointments or you cancel them within 24 hours of your appointment, you will be discharged from our service. We have back-to-back clinic slots booked, so it's essential that you are punctual for all virtual or face-to-face appointments. Thank you for taking the time to listen to this presentation. If you are interested in joining the BMI surgical programme, please contact the front desk team on 613-730-0264 to register and provide some follow-up information.